Yeah, just a quick question. I think I'll like to have both you and your friends over here and everyone. Um, this IVL is now gradually coming into Pakistan. So the one big question is that with the rotational arthrectomy, one rule is that you never do a rotational arthrectomy of the last surviving vessel. So what are your take on the IVL as the source for a last surviving vessel if you have to do it? One. Secondly, if you initially thought that the calcium is not going to be that bad and you have deployed your stent, but your stent is not deploying well, is IVL a safe item at that time? Can you go back, do an IVL of that calcium at that moment, and then come back? So, Mohammed and Omar, you're all over here, so let's have an opinion.
How about keeping this? Wondered, do you want to answer this question?
Sure. I mean, obviously, you could use IVL. If you deploy the stent, there is a little bit of some evidence that it might affect the polymer, but sometimes you have to take the benefit and the risk. And of course, for the little effect on the polymer, I would accept that I'd rather get the stent well expanded and well opposed rather than worry too much about the polymer. As for using the IVL, I think you said before, I missed the first part of the question. Sorry.
There's always the chance that you may lose the
Anyway,
vessel
sorry,
after a birth.
I will just.
In the last remaining vessel, yeah.
Yeah,
I think it's probably unlikely because IVL is almost like a normal balloon. Of course, with rotablation or orbital, there's the chance of no flow, about 1%, but nonetheless it's there. So you really have to be very, very careful, and you have to balance the benefit to the patient because sometimes we have to do something that's out of the norm if that's the only option we have. Of course, the benefit and the risk are the most important thing to weigh. IVL, I'm not aware it causes too much no flow, and I'm not aware because if you are going to treat that vessel, you are going to inflate the balloon anyway. So last remaining vessel, you might have to reduce the time instead of 10 seconds, you would do it for 5 pulses at a time, possibly. But I think you can use it, and you can use it for under expanded stent. I use laser with contrast more for under expanded stent, but I aim not to prepare the lesion much better before I put my stent in. But sometimes we all have faced this where you think you've prepared the lesion well and you put the stent hasn't expanded. So you can use IVL and you can use laser also.